this video, we are going to talk about the surgery process of my mitral heart valve repair. So with this, what happened was I went down to Mayo the day before. I had to do my pre-op, and that's just some simple, just blood values, just like your blood pressure, heart rate, and then it was more education on what to expect. The night of, they give you some soap and some medication to put in your nose. So they want to decrease the risk of infection as best they can. So they give you this special soap that you need to use the night before, and this medication that you put in your nose and the oral cavities that have moisture and are exposed to the outside that potentially could have bacteria in there that could get down to your heart and have an infection, especially with surgery. Side note, I also, before this surgery, any kind of heart surgery, you're always going to have to get clearance from your dentist as well, because they don't want any infections in your mouth as well to travel down into your heart, okay? So that make sure that your mouth is clean and has no problems. So night before, shower, and there's special soap, put the medication in, wake up early. I had like a 7 a.m. Surgery, so I had to get there pretty early. Same thing, they want you to shower that morning with that soap again, and put the medications in. Arrive, we check in, and I'm gonna go back on another thing. We also had to get a COVID test a few days before. This is COVID times. Well, now, when you watch this in a few years, you're probably not gonna have to do that. That was another step in the process of this whole thing. I had to go get a COVID test, make sure it was, cleans or negative, so I could get, so you're sitting on edge always, right? Oh my God, is this COVID gonna be positive? Then I have to push back my surgery, and then I have to change my work. So that was kind of a stressful thing, honestly. But that was good. Show up, do the pre-op room. They have to get you ready. This was probably the most, I guess, awkward part of the process. Even as a healthcare professional, I see people a lot of times where we have to expose areas and stuff like that. But pretty much you had to get naked and put on these like undie things that they have now. And then someone came in and they had to shave me with a buzzer from my chest all the way to my ankles. So they took off my leg hair, they take some of the groin hair off, or the pubic hair. And I don't have much chest hair, but if I would have chest hair, they shave it all off because they have to clean the surgery area. And why did they go about the ankle? Well, in the groin, and I have a scar here as well, that's where they hook up the heart bypass, okay? So that's where they cannulate you, is right in the groin. So they have to make sure that's clean too. So they just go ankle to chest. So you're laying there, and pretty much this, for me as a gentleman, is just shaving you, and you're in these undies before you put your gown back on. So after that, I met the fellow anesthesiologist, and I met one of the two surgeons. So I met the second surgeon. So in this, when you do a robotic assisted surgery, there's two surgeons. One is in the corner working on the Da Vinci machine, and one is actually standing over the patient and manipulating the robot arms to make sure they're at angles that are appropriate to get the job done. So I met the second one before that, and then went into surgery, and you hop on over to the surgical table, and the anesthesiologist hooks you up, and before you know it, you're out, okay? Surgery took 6 hours, and it's only about 2 hours of actually operating the heart. It's the first 2 hours are, getting you prepped, getting anesthesia, getting the robot in place, making the portals and the incisions to put the arms of the robot in. So it's a lot of tedious work on the front end, setting you up to the ventilator, setting you up to the bypass heart machine, because they shut your heart off. Pretty much they take the blood away from it, makes the heart stop pumping, and then they put some kind of solution in there that also makes it kind of relax a little bit to make their job easier to operate on the heart. And then the machine operates as your heart for you during the whole operation. And then operation was 2 hours of actual operating the heart. And then there was 2 hours of taking you off the ventilator, taking you off the heart bypass machine, taking the robot. So yeah, it's really only 2 hours of operation, but there's a lot of tedious stuff. So it's a 6 hour process is what it took for me. I remember waking up in the ICU, and this is where I had a lot of stuff on me. And I'll show a picture of the different things, but it's an arterial line. There was 2 chest tubes. I had a jugular line up here. You have an IV hooked up to you so they can give you medications if need be. They had me on oxygen through a nasal cannula. That's not that bad. So when you wake up, there's a lot going on right there. So to be expected, the normal things that you would have from the surgery. The biggest thing I had right away was the pain in my back, and right, it's not even the incision sites that were that bad. It was in the back, and it was probably because they jacked me up in some awkward position through the surgery. That was very sore. So that's when I woke up. I was taken, so in the ICU, like I said, I was there for a little less than 24 hours. I didn't sleep at all really well that night. I didn't really sleep well the whole time in the hospital. I was on Oxy every 3 hours. I took Tylenol every 6 hours. And I had the option to get Dilaudid or ketamine when I was in ICU. I believe that was every 3. I don't remember that one. Don't quote me on that one. They will tell you, the nurses. They're wonderful. I only did ketamine once, and that was in ICU. After I got out, I did Dilaudid a few times. No, you're going to be cath too, so I had a catheter as well. So before I left the ICU, they took the catheter out of me. They took the jugular access out of me, and they took the arterial out of me as well, pressure. And I moved up to the floor, and I had my own nurse, for that room. In that point, I was in a little pain. Coughing really was painful, wasn't fun. But that's once you're there, up in the other room, it's, hey, we got to stand up. We got to go on walks as best we can. Every time we're eating, we're sitting up to eat. You're using the spirometer, so they'll give you this thing to work on breathing. It measures when you suck in, it goes up, and you're really working on improving your lung capacity again, especially because you got vented, and you have to build up that strength again of your respiratory muscles. I think the biggest thing I would say with people, and they always say, is stay on top of your pain medication. I think the most frustrated I got was one of the nights I finally was sleeping good, and the nurse didn't wake me up and give me my medication. She said, oh, you were sleeping so good. And so when I woke up, I was in a decent amount of pain, so I had to take some Dilaudid in there as well. I would maybe talk to them and say, hey, I would still like to be woken up because I'd like to stay on top of medication. I can go back to sleep if need be. I think, let me see here. The hospital, it's pretty, you're just trying to get good enough to go home. At the end, they took the chest tubes out before I left that last day. I think I didn't go to I didn't defecate or I didn't poop throughout the process because the pain medication shuts that down. I took a few days after. So you're taking a stool softener as well. You're taking Eliquis, which is a blood thinner, and aspirin as a blood thinner to help with it, because when they go in the heart, they're putting a annuloplasty, so it's a foreign object. So they like to put blood thinners on with that. And then, I think that's for the most part. Just make sure you're getting up and walking, doing some exercises. Laying in bed's not going to do you any good. You want to get out as quick as possible. Get moving. Make sure you're eating. Stay on top of your pain medication and try to sleep as best you can. So I was lucky. I was there for just 3 days pretty much in the hospital. We didn't have visitors during my time because of COVID, so it was just me and my nurse the whole time. But it was fine. That was my process of the hospital, the surgery day of, and I hope that gives you an idea of what to expect. I do want to note, they took the catheter out, did not like that. But when I went up, you have to make sure you're peeing that. And then if there's if your bladder fills up to a certain amount, like over 500 milliliters, I believe, and you haven't gone and you can't get it out, they're going to cath you again. So I went once, and it was really tough. I literally had to sit there and put my hand in hot water while I was just sitting on the toilet waiting to try to get myself to go. Worked once, and then I hadn't gone for 8 hours, and they're like, well, there's a note or alarm to check on this. So they brought a guy up, and he does an ultrasound on your bladder, and he's like, yep, there's 500 milliliters. I'm like, so if I don't get this out, you're going to cath me? He goes, yep. All right, well, I ran to the bathroom, and I sat there for about 20 minutes under hot water, and I got that out because I was not getting cathed again. So that was a little bit of a struggle there. But that was my hospital stay. It's nothing too exciting. Surgery went smooth. It wasn't too much painful. It's pain, right? It's there. Make sure you have a pillow that you cough. It helps decrease it because that will hurt because it expands your rib cage every time you cough, and the muscles contract. and that's going to it's gonna be painful when there's incisions that are still healing. Okay, so I'll talk about recovery at home and after that. Thank you for watching this video. If you found this information useful or helpful, please subscribe to this channel. Just drag that mouse right over to the red box, click it so that you're notified the next time that I post a video. Again, thank you so much.